Good day, everyone, and welcome back to our training on Advanced Basic Life Support for Prime Care Nursing Practice. In this session, we will continue our discussion on AED and Post-Resuscitation Care. But before we proceed, let's quickly review our previous lesson. In our previous lesson, we taught about how the AED is integrated into the BLS sequence, and we also demonstrated correct pad placement for adults and children, and also apply safety precautions and special situation adaptations during AED use. Now back to our topic. By the end of this module, participants will be able to know how the AED is integrated into the BLS sequence, identify ROSC signs, and demonstrate immediate post-ROSC actions. Now, let's get started. How is the AED integrated into the BLS sequence? The rescuer should not wait for the AED before starting CPR. Compressions must start first if cardiac arrest is confirmed. Once the AED becomes available, it should be integrated quickly and safely. After a shock, CPR must restart immediately. The AED should support CPR, not replace it. The AED fits into the CABD sequence. Now, let's break down the AED fits into the CABD sequence. The C means circulation, begin chest compressions. A means airway, open the airway. B means breathing, give rescue breaths. And D means defibrillation, use the AED as soon as it arrives. Note: CPR and AED use work together. Neither should unnecessarily delay the other. Now, let's look at what return of spontaneous circulation, ROSC, is. Return of spontaneous circulation means the patient's heart has started pumping blood effectively again. ROSC means the patient is showing signs that natural circulation has returned. The rescuer must stay alert for these signs during CPR and AED use. The common signs of ROSC include a pulse, spontaneous breathing, improved color, movement, improving level of consciousness. Note: ROSC does not mean the emergency is over. The patient still needs urgent support and close monitoring. Let's quickly look at what should be done immediately after ROSC. If the patient is breathing but remains unconscious, protect the airway and monitor closely. In simple terms, post-ROSC care helps prevent the patient from collapsing again. Once ROSC occurs, the focus changes from resuscitation to stabilization. Immediate priorities include maintain the airway, support breathing, keep oxygen saturation above 94%, monitor pulse, monitor blood pressure, monitor consciousness, observe for rearrest, prevent complications such as hypothermia or hypoglycemia, prepare urgently for transfer to advanced care. Note: post-ROSC care is essential because rearrest can happen if the patient is not stabilized properly. In summary, start CPR immediately and use the AED as soon as it becomes available without delaying compressions. ROSC means the heart has started pumping effectively again, shown by signs like breathing, pulse, movement, or improving consciousness. After ROSC, focus on stabilization by maintaining the airway, supporting breathing, monitoring vital signs, and watching for rearrest. And that is it for this session. Thanks for watching. See you in our next session.